My name's Jillian Booth. I'm a scientist at the Center for Research on Inner City Health at St. Michael's Hospital in Toronto. We know that rates of obesity and diabetes have been increasing tremendously over the last 2 decades. And we hypothesize that neighborhoods that are more walkable and less car-oriented may have better outcomes. The objective of this study was to see if rates of overweight and obesity and diabetes incidence are rising more slowly in neighborhoods that are more walkable. We used provincial health data and survey data to study nearly 3 million people living in Southern Ontario cities. We looked at the prevalence of overweight and obesity and diabetes incidence over a 12-year period, focusing on populations who are between the ages of 30 and 64. We looked at these patterns over time according to neighborhood walkability. We found that the patterns over time were much more favorable in highly walkable neighborhoods. Rates of overweight and obesity were about 10% lower in highly walkable neighborhoods compared to less walkable areas, and the rates were more stable over time in highly walkable neighborhoods, whereas they were continuing to rise in less walkable areas. We also found that diabetes incidence rates were much lower in the most walkable neighborhoods compared to less walkable areas. And in fact, they decreased over time, over the 12-year period, in the most walkable neighborhoods, whereas they were flatter or more stable in less walkable areas. We found that the neighborhoods that were more walkable also had a higher number of walking and cycling trips, as well as higher numbers of transit trips and far fewer car trips compared to the less walkable neighborhoods. We have to be careful about interpreting the study because it is ecological. So it doesn't mean that if we design neighborhoods differently that we'd actually see a decrease in obesity and diabetes, but it certainly is an optimistic finding. There's a huge momentum right now to look at making more walkable communities, and I think we're going to have to be evaluating the changes that happen in terms of urban design over time and see what their health impacts are. We're also, as a research team, looking at what type of interventions would be the best investment for policymakers, whether it's expanding transit, changing how neighborhoods are designed, or all of the above.